What do I understand by co-production? Well, I think that's a tricky question, and I think it's one of these terms that means different things to different people. But I largely see it in terms of cooperation and ways in which you might support or facilitate sort of cooperative relationships, say in practice, where people are able to negotiate the sort of care that they get, or maybe at a strategic level it's about much more democratic decision making in terms of implementing policy or even creating policy in the first place. I think once we're on the territory of democracy and cooperation, there are really interesting questions that can be asked about legitimacy. So, what are the sort of rationales and reasoning behind why these ideas gain traction, or also the barriers and impediments that are used to block them from time to time. And I think in the mental health context, there are all sorts of legitimacy crises facing, the professions, for instance. So some of what's up for grabs is a sort of recalibration of professional identity to become possibly more rather than less democratic. And I think the last thing I'd like to say on this is that if we're thinking about cooperation, we also need to think about people who aren't so cooperative but try and understand why that might be. And I think in mental health there are a bunch of people who don't really appreciate the claims that psychiatry can make for deciding how best to understand the nature of people's problems and needs, and the prescriptions for treatment, which are largely medication based. And I think those people, when psychiatry is the only show in town, are disinclined to cooperate for understandable reasons, and they might be best described as resistive or even recalcitrant. And I think the idea of recalcitrance is worth thinking about just as much as cooperation is. And as much as I'm a fan of cooperation and think it's the way forward, and I'm a fan of democracy and think we need to democratise society as well as services, I think we can't just wish away the idea of resistance and recalcitrance. And in some sense that might be the creative spark for doing better things in the future. So what do I think are the key facilitators of co-production? Well, at least one of them, I think, is that it would be naive to think we can democratise psychiatry without thinking about what sort of social system psychiatry exists in. And I think people don't necessarily grow up with great expectations for inclusive participatory democracy, and they're possibly, and there's evidence for this, disenchanted with our sort of representative systems of democracy. So I think when we think about co-production in services, we have to think of how to make it as participatory and maybe a democracy that's framed around deliberation, rather than, say, at the strategic level, try and rush people towards voting on things. One of the dangers there is a sort of tyranny of the majority, rather than a more considered and nuanced exploration of alternatives that might come out from longer discussions. And then also, because people are really quite legitimately wound up and passionate about issues in mental health, we shouldn't be excluding people from discussions just because they get a bit turbulent and unsettling. So I think the professionals have to be big enough and ugly enough to roll with turbulent and aerated discussions, with the idea that if we stick with that for longer, and especially we have some humility entering into those conversations, we get to a better place in the long run. And let's face it, we've got time to do this, I think, because psychiatry as it is has crumbled on for 200 years or so we could probably take a little bit longer to think about how we might make it better. So what are the key changes required in approaches? So I think I've mentioned some of these. I think the professionals have to some extent re-socialise themselves away from a sort of biomedical model. I think one way to do that is to be appreciative. I think we need to empower staff, particularly staff in the lower hierarchical grades within the health service, so that they're ready to actually think about empowering patients. So I think we've got a number of different forms of oppression and disadvantage going on in society and in psychiatry. And I think again it'd be naive to think that we could democratise the relationships between professionals and patients if we don't do something to empower and emancipate staff who work in services as well. Some of that needs to be at pre-qualifying training level, so I think we should talk about democracy and think about it in a practical and theoretical way in pre-qualifying training. And one of the things I think that's wrong in universities at the moment is the forms of knowledge that would lead us there are the ones that are being squeezed out of academia, knowledge that's in the humanities. And it seems to me that in my discipline, in nursing, there's much more of a push on task-orientated, competency-based training without the wraparound of more sophisticated knowledge that might help people do those jobs in a more rounded and holistic way, and maybe resist the sort of fragmentation of their roles into tasks. Maybe try and creatively imagine how their jobs might look if we all had more say in how the work of mental health was actually organised. And I think one of the ways we could take this whole co-production ethos is to think, if this was a car factory, for instance, it can go in two directions. It can become, following Henry Ford, a very oppressive, dissatisfying, degraded form of work, and then that's even before you factor in patients. Or we could make it more craft orientated, offer the staff more autonomy, but bring in patient voice as well, so that we organise those jobs in a way that suits everybody. And instead of having services that reproduce a whole load of alienating technologies and alienate the staff as much as the patients, we get something more virtuous that allows people's common humanity to breathe and thrive. And in some sense we could call that an industrial democracy, a sort of workplace democracy, and we could actually orientate the jobs we do to democratically organised decision making in healthcare workplaces. So examples of where I've seen that, well, in a sort of utopian sense, nowhere. But I think there have been in history some really neat examples of this, at least in part, and maybe one way to change things is to think about very situated, small-scale exemplars. In my university, we organise a thing called Commensus, which brings service users and carers from a number of different perspectives into the university to largely deal with the education of practitioners, but it also has some influence in the research field. And I think that is not perfect co-production by any means, but it has some really quite democratised features to it. And maybe university places are less loaded than the clinical arena. There's more chance to sort of deal with people on a sort of equal and respectful basis. And obviously there's a lot to be desired for the organisation in terms of improving the quality of educational experience. And within that, quite radical ideas can come out, sometimes when the institution is fairly indifferent to whether those things are talked about anyway, but as a matter of course that they do. I have looked at some involvement practices in secure mental health services in Yorkshire, and I was very impressed with some of the ways in which they worked, and they used a quite embodied approach to democracy. So people who weren't used to having a say, and sometimes were very, very lacking in confidence in terms of speaking up, were able to engage in exercises, say simple things like just moving to the corners of the room where a particular proposition was marked up, so that you didn't have to say, I agree with this, you just moved over to the space where the issue that you agreed with was located. And then from there, growing confidence to actually, expand on those propositions, defend them, maybe ask colleagues who are standing in another part of the room to come over to you, or if they persuade you that their idea is better, you move over to them. And I think what struck me there was the people who came to those events were service users from a number of different secure units across the region, and members of staff who came with them. I think some of those people, you could almost see they had epiphany moments where the value of what they were doing became apparent, and they could see over time, and this is really important, that some of the decisions they were party to made a real difference in practice. So I think talk that leads nowhere isn't any good. It has to sort of confirm its value by actually being seen to make a difference. So managers and commissioners to some extent had to be present or engaged, at least indirectly, in those discussions. The not so good part of some of that was the fact that if you then went to see how democracy worked inside the walls of the secure units, some of the more dynamic and creative forms of decision making that existed in the community setting where they had these general meetings didn't necessarily carry back in its ideal form into ordinary hospital wards. And I think that might be something to do with the confidence of the staff, or the fact that you concentrate in a regional initiative all the more able people, the people who are already motivated and signed up to those ideas. And once you get back to the ward, some of that enthusiasm is diluted or even resisted by people who are not so keen on those ideas. So I think there's a long way to go before we see co-production as good as it might be. And that, I think, should warn us to not be gung-ho and too celebratory of what we've got at present, even if it's a vast improvement on what's gone before. So one of the dangers is, I think, that if we do some sort of co-production, because it's different than not listening to people and not including them in decision making, people can be really appreciative and the process of being in care can be improved. But that's seen that in various places, people are very, very appreciative of involvement practices when they happen. But to some extent that pacifies dissent and people stop kicking up a fuss about things that they haven't got, or they become cooperative with a system that they don't entirely agree with. And I think one of the hazards of co-production is it becomes less emancipatory and more a sort of pacification process. So as much as I'm a fan of it, I think we need to have a critical eye on it as well.